Golden Gate Bridge in San Francisco. That's Senator Feinstein's hometown. 18.5% of California does not have health insurance, which brings us to our next topic as we welcome you back to State of the Union. I'm joined once again by four leading voices in the U.S. Senate, Republican Richard Lugar and Democrat Diane Feinstein, Republican Chuck Grassley and Democrat Bob Casey. As we move on to the health care debate, let's take a look at one of the reasons the debate in the Congress went off the tracks a bit this past week. The Congressional Budget Office took a look at the leading Democratic plan, said it would cost $1 trillion or more over 10 years, and it was estimated to reduce the number of uninsured by just 16 million by 2015. Why is that important? Let's go to the next number here. You will see, without the $1 trillion plan, the Congressional Budget Office says there would be 51 million Americans without insurance in 2015. After spending $1 trillion, the Congressional Budget Office says that number would still be 35 million. That has led many to say too much money for too little gain. Senator Grassley, you are the ranking Republican on the Finance Committee, the key committee when it comes to paying for this. You spent much of the past week shuttling with a few other Republicans in and out of the Democratic chairman's office. Can you tell us today that progress toward a bipartisan plan has been reached, or is health care reform this year in peril?
Well, it has not been reached, obviously, yet, or we'd have a bill for Tuesday for committee action. But we're still working. Our goal is affordability for people to have insurance and accessibility, to do away with the discrimination that comes from people not getting insurance because of pre-existing conditions. Our goal is to insure 45 million Americans that don't have health insurance and to make it affordable. Our goal is to do that. Our committee has a responsibility for finance, but also don't forget our committee has the responsibility for a lot of health care policies as well, because we have jurisdiction over Medicare and Medicaid, and we feel that we will be able to put together a bipartisan plan that will do what everybody wants to do, accessibility and affordability, and we'll be able to pay for that, and we will not have the problems that you described of $1 trillion and only covering 16 million people. Now, we have a separate piece of legislation than the one you were referring to, because that was the other committee, the Health Committee, and of course, that's a major problem. But we also had a score from the Congressional Budget Office on ours that brought it in higher than we anticipated, so we're in the position of dialing down some of our expectations to get the costs down so that it's affordable, and most importantly, so that it's paid for, because we can't go to the point where we are now of not paying for something when we have trillions of dollars of debt. And we anticipate paying for it through some savings in Medicare and from some increases in revenue.
Senator Lugar, before I get to the Democrats, Senator Grassley is under pressure from a lot of Republicans because he's negotiating with the Democrats, saying don't go too far, don't give away the store. What is your message in this debate? Can we do all he just said, reform Medicare and Medicaid, insure those 45 to 50 million uninsured Americans in one full sweep, or should there be some incremental steps first?
Well, I think it should be incremental steps. As a matter of fact, I don't have the slightest idea what is in either of the two bills of the committees. None of us do, because much of it hasn't been written. It's still being drafted. People are scoring something that it doesn't exist. What I would suggest is we hang on now for a period of study so that we find literally what the alternatives are.
So not this year, like the president insists?
Not this year, because the president is trying to solve the economic crisis in our country and the world. We already have a $1.8 trillion deficit projected, quite apart from all of this. We're going to have to be thoughtful about the dollar. Will the Chinese continue to buy our bonds? Will the Japanese likewise to pay our deficits? We can't pay them right now with the resources of this country. This is alarming. And therefore, health care is very important, and reforms might occur incrementally even this year. But this is such an audacious move that it threatens more than just the health care problem. It threatens our basic structure of our economy.
Senator Feinstein, I see you nodding. I want you to come into the conversation to see if you agree with Senator Lugar that it should be incremental. But first, I went out to the Cleveland Clinic this week. The CEO is very impressive, Toby Cosgrove. It's a place where they give some of the best care in the world, and they do it at a much lower cost than many places around the world. And he is a big champion of reform, the CEO is, but he also worries about the cost. I'm going to liken it to that ketchup or mustard pack you get at the ball game. If you squeeze it too hard, it sprays out somewhere and you get unexpected results. He said he is worried. The president has said, as you know, and your state would be hard hit by this, that the immediate savings should come from Medicare and Medicaid. That's one of the ways to pay for it. Dr. Cosgrove says that might be fine, but if you do it too fast and you take too much out of the program, there will be huge negative results. Among them, he says, could be this.
The first thing you'll see happening is a deferment of all the reinvestment in the infrastructure. It's a classic example of that's what's happened on national health in England. I mean, they didn't invest in any of their infrastructure for 50 years. And now a lot of the hospitals in England are 100 years old or older and way behind. So, you know, if you begin to take money out, it will make a difference, and it will hurt the system in some way.
As a leading Democrat in the Congress, is your president trying to seize this political moment because he has the votes right now and the political capital in the first year in office? And might he, as a result, potentially do more harm than good if you try to do this all at once?
Well, to be candid with you, I don't know that he has the votes right now. I think there's a lot of concern in the Democratic caucus. You know, Senator Lugar's point about the economy, the, you know, trillions of dollars that have gone into buttressing the economy. Now we're going to be dealing with regulation of the financial sector. What all the impact of this is not yet known. Ergo, you have enormous problems in my state. California is bigger than the populations of 21 states and the District of Columbia put together. We have an enormous healthcare industry, 350 hospitals. University of California alone has 34,000 healthcare workers, has healthcare worth $4 billion a year. So it's complicated. Additionally, the state is in a state of financial catastrophe. I think that's clear. So if you change the Medicaid rate, for example, it has an impact on California between $1 billion and $5 billion a year. Now, how could I support that? Because it would take down the state. You also have enormous profit centers in the healthcare industry, in pharmaceuticals, in medical insurance. And I wonder about these profit centers, because unless you have some method to control these profits, premiums continue to rise in the private sector, as they have over the past 8 years substantially. Therefore, controlling cost is a very major and difficult subject as long as you have a large private sector involvement. So this needs to be worked out. The issue of coverage, I think you raised over $1 trillion to cover 16 million people. We have 6.6 million people without coverage and below the poverty line. So just to cover them becomes a huge, huge problem.
So, Senator Casey, come into the conversation with your views, and as you do so, Senator Feinstein, a Democrat, just raised some significant questions. She'd like to get this done, but she has some big questions. Senator Mary Landrieu of Louisiana is another Democrat who lives in a more conservative state. She has raised some questions. The reward for her raising questions has been a liberal group, MoveOn.org, is now attacking her on the radio. Let's listen.
Why is Mary Landrieu opposing the president's plan to provide health care choices for all Americans, including the option to join a high-quality public health insurance plan? She did receive $1.6 million in campaign contributions from the healthcare industry, the same industry that's now spending millions to stop the president's plan. Call Mary Landrieu.
Senator Casey, is that helpful? That's an ally of your party, MoveOn.org. They have helped the Democrats in elections. They helped President Obama in the election. There's not a bill to vote on yet. There are people like Senator Feinstein, like Senator Lugar, like Senator Grassley. I bet Senator Casey has some questions about this legislation. And before there's even a bill to vote on, she's being attacked on the radio. Should the President of the United States, the leaders of the Democratic Party, tell MoveOn.org to save its money and get off the radio?
Well, John, I'm not sure we can be in the business of telling groups how they spend their money, but look, this is very early. I don't think either side on this should overreact. People in the Democratic Party, groups that support us, nor people in the Republican Party. There's still an awful long way to go here. But the reality for a lot of families in Pennsylvania and across the country, just to give you one example, in Pennsylvania, if you look at the 2007 and 2008, at some period of time within those 2 years, more than a quarter of our population had no health insurance at all. It's a huge number, and the same is true across the country. The worst thing we could do is to sit back and continue to wait and debate for too long.
I will continue to cover this issue and all the other issues as we go forward. I want to thank all of you, Senators, for joining us for a long, extended conversation today. And yet, believe it, despite all this time, I have more I wish I had time to ask, but we'll invite you all back. Senator Casey, Senator Grassley, Senator Lugar, Senator Feinstein, thank you so much.